Rocheford's for plastic surgery, so stay tuned for that. Welcome back to Girl Talk. We are at Rocheford Plastic Surgery in Woodbury, and we're gonna go in and take a look. Let's go see what they have to offer us.
Sometimes a girl needs a little help from a doctor to help look and feel her best. That's where my visit with Dr. Rocheford comes into play.
I focus exclusively on cosmetic plastic surgery. I've been in practice on my own since 2003. I've actually finished my residency in 1998. I'm board certified plastic surgeon and hand surgeon. Since 2003, I've been focusing exclusively on cosmetic surgery. The most important thing really when you are choosing a plastic surgeon is your relationship with that plastic surgeon. You want to be with someone that you're comfortable with because hopefully everything goes great and there's no problems, but if a complication arises, you want to be in a relationship with someone that you feel comfortable talking to, comfortable asking questions with, that you feel is going to pay attention to your needs. Obviously, I'm a board certified plastic surgeon. I'm certified by the American Board of Plastic Surgery. I think that's important.
Being board certified means a doctor has completed an accredited residency program, passed a written and oral exam, receives continuing education, and maintains that certification every 10 years.
So you know that someone that's a board certified plastic surgeon is constantly being educated and really paying attention to high quality and patient safety, which is really the most important thing, especially in elective plastic surgery.
It's always a good idea to get a second opinion before making a huge decision, such as whether or not to go forward with any type of procedure.
Anything cosmetic related, breast augmentation, tummy tuck, liposuction, rhinoplasty, eyelid surgery, forehead surgery, Botox and wrinkle fillers. I do also earlobe repairs, small mole removals, small scar revisions. Sometimes people get keloids behind their ear from earrings and I remove those as well. All that can be done in the office under local. All those other bigger procedures are obviously done under general anesthetic at an accredited facility.
Depends on how deep the sun damage is. The deeper the sun damage, the more treatments you're going to need.
Less invasive procedures are also available in a consultation with Angela.
An esthetician is a skin therapist, basically a medical skin therapist, or there's also spa skin therapists. I'm a medical skin therapist, so I got my training background 10 years of medical, and then also I had advanced training in lasers.
Hair removal, diminishing brown spots, acne treatments, skin tightening, and other procedures are Angela's specialty.
What we'd also do with that specific spot is we'd also do the erbium laser, which again would remove it a little sheet of paper at a time, bring it back down to its normal skin cell level, and also remove the hard-plated cells. Brown spots are very common among people. They are caused by the sun, so they are not hereditary. What happens is when the sun hits the skin, they cause a browning, or the skin cells get upset, they group together, they actually form brown patches. With laser, what that does is also seeks by color. When we turn on the laser and we switch the laser on, when we place it against the skin and treat the skin, what it does is it looks for brown patches, and from there it'll turn the brown browner first, and then the brown will rise from the surface in about 7 days and begin to slough off. It does make a little bit of a snapping sound, so that's, I think, the most unnerving for anybody is that it does a little snap.
Keep in mind, there's always some type of risk involved.
With surgery, the risks are essentially the same for any surgery. There's always a risk of infection, there's always a risk of bleeding, there's always a risk of asymmetry. Sensation loss is always something that can happen after surgery. The big concerns for most people are infection, and actually most people's concern when it comes to surgery is, am I going to wake up? And general anesthesia is very, very safe. The risk of general anesthetic, the risk of death is less than 0.001%.
I'm all finished.
All right, Colleen, and here's your bill.
Thank you. Let's see what my husband's gonna say. I'm gonna give this to my husband and he will think he upgraded to a new model.
For your upgrade, check out Rocheford Plastic Surgery.